We have a very large proportion of patients that actually come through who are First Nation or Métis. Occasionally you do get patients who are Inuit. And these patients do experience things differently. I think objectively as a clinician, the way that the patients react to this environment, being in the hospital, it's a lot different than living in the community.
I've had clients that spoke absolutely no English at all. It was straight Cree. So the nurses would call me quite often to go and translate for them and spend a lot of time with these clients, because then they'll tell me their concerns because they can't verbalize with the staff. So I found that really interesting and very successful, that we were able to communicate and find out what their needs are.
Ihi 120 over 80 o matastio.
The doctor or the nurse will page me if they feel like the patient is not understanding them. They will page me, and then I'll go and translate for the doctor and explain. I sometimes will tell them, because there's a writing board in front of the patient's bed, to even draw what they're explaining about, because most of the Indigenous people are more visual learners. When a family member is palliative, I make sure that there's extra rooms where I can book for the family to wait. The staff there, all these years that I have worked there, they have completely acknowledged and understood the families coming in. If there's large families, they accommodate them. If a family member needed to travel like 5-6 hours to come and see a patient who has passed away, they will wait for that family member to get in.
If a person wants to have a ceremony, I will try and find someone that will do it for them, or usually they'll have someone in mind. I'll just make the arrangements with the hospital here. And if I know a person who's Christian, then I'll offer them like devotional books or Christian magazines to read and stuff. So I try and offer both.
So once a month, I'll cook a meal, like a traditional meal for them. Like a few months back, we had moose nose soup and bannock. And then sometimes if I can get the moose or the fish, I'll cook it for them right there at the recreation department. Some of those long-term patients treat me like I'm their granddaughter, and I just love it. It's the best job I've ever had.